Welcome to Idea Talks. In this episode, we're meeting with Dr. Nadine Delicata, a medical doctor with extensive experience in the healthcare profession. And during this interview, we shall be discussing the opportunities and challenges of this evolving industry.
Malta's future starts with a conversation. Idea Talks.
What's changing most in healthcare right now?
Good question. I think healthcare is changing on multiple fronts at the same time, which renders the healthcare landscape quite complex, actually. We are facing shortages in the healthcare workforce, an aging population, increasing costs, growing demand, and at the same time we're expected to provide better care which is safer, and care which is person-centered. So balancing the two is quite a challenge. Furthermore, I believe patients are becoming more informed and more knowledgeable, so of course their expectations are changing too. And this is also a driver for change in the healthcare sector. And then in parallel, we cannot not mention the big advances being made in medical technology and artificial intelligence, which are already changing the way we work.
We'll get to that a bit later on, even regarding the resources and the human resources in this sector, because there is a lot of discussion and debate regarding even the role of third country nationals in this sector.
Absolutely.
But we'll get to that a bit later. Let's take a step back. Can you tell us something about yourself, your background? How come you have been so actively involved for most of your adult life now in the healthcare sector?
I'm a medical doctor by training. I went on to specialize in public health and in healthcare management. Currently, I'm working as a consultant in public health with the Ministry for Health and Active Aging, and my role currently is dealing with national policy. But I have years of experience, as you said, holding senior leadership roles, both locally and abroad. And I've touched basically, I would say, most aspects of the health service, from planning and implementation of national programs like the cancer screening services, but also hospital operations, hospital design and build, capacity building, more recently quality and patient safety and governance. Besides that, I'm also an academic. I research and I lecture. Again, in areas related to leadership and health management. And I believe you asked me what led to this. I think early on in life, I lost two important family members to cancer at a young age. And perhaps that experience helped me realize what impact thinking at systems level has on patients and their families.
So there was no one in your family who was a doctor and you followed in their footsteps?
Actually, my older brother was a surgeon.
Okay.
But when we were growing up and wanting to study, he wanted to become a vet. I was the one who wanted to become a doctor. Eventually, we both became doctors. If it wasn't healthcare, if it wasn't the medical profession, would there be any other area which you would have considered? Probably, I would have considered law.
Okay.
Because I also have, of course, through my experience, been very much involved in legal discussions and legal frameworks, and I can see how important they are as well to the healthcare field.
That was a discussion, an internal discussion I had with myself when I was much younger, whether I should pursue the legal profession or the medical profession. But I was never so scientifically inclined, so I opted to go to pursue my law studies. Back to healthcare. You said AI.
Yes.
How is AI now reshaping this sector? And if one follows what's happening in the US, in countries like the UK, Germany, France, AI seems to have become quite an integral part of the healthcare sector. But in Malta, is it the same?
I would say we're getting there. I think AI can offer a lot of support. I see AI as a tool both for decision making, but also to automate, for example, routine processes, and to perhaps offer better use of data. But AI will not replace a healthcare professional. I believe that if used well, it can help us streamline processes, and it can reduce the administrative burden significantly, which would free up our very busy professionals in a context of workforce shortage to dedicate more time to the human aspects of care rather than focusing on paperwork and files and what have you.
So you're saying areas like electronic patients record?
Yes, electronic patient record, but not only. For example, nowadays abroad, predictive analytics, so data is being, AI recognizes patterns of data, and you can feed in, your data so that you come up with predictive analytics to, for example, analyze your busiest times, and therefore you can direct your workforce accordingly and plan better. Of course, there are robotics and all the fantastic things that we can do with that as well. But AI does not grasp the human context. Mm-hmm. It can, yes, provide information, but it will not be able to reflect the lived experience of patients and their loved ones.
So you don't foresee a situation, at least in a time soon, whereby AI will take people's jobs in the healthcare sector?
I don't think so. I think, however, our skills as healthcare professionals will need to change. I think we will definitely need to improve our digital literacy, definitely improve on critical thinking, and also on our ethical reasoning. Because one thing we need to do is to challenge AI, and we need to interpret the data that AI gives us for the betterment of patients, clearly.
Okay. In Malta, we have, I would say, a good healthcare system. But of course, each and every area, be it healthcare, be it whatever area, whichever area we're discussing, it does need fixing, certain areas. Which areas of the healthcare system in Malta do you think need fixing?
As you said, we have a lot of strengths to the system. So if I may expand a bit on the strengths before we go to the areas that need fixing, I think we have a very competent and committed workforce, a good public health infrastructure. We have universal access to healthcare, and we do offer areas of excellence in several areas of expertise, clinical specialties. For areas that need improvement, I would say from the workforce perspective, I think, of course, the workforce shortage does put a strain on the system, and often we rely on people going that extra mile, going out of their way to keep systems running. This takes its toll on workforce well-being, on mental health, and we really need to invest in equipping people with skills like resilience, with tangible mental health support at the workplace to enable them to cope. Of course, technology and investment in technology can help support the workforce and free up time to dedicate to care. Other areas that need improvement, I would say, from the system's perspective, is that we very often tend to react by crises.
Okay.
So I would like to see a system where we plan. We plan rather than react to situations, and we plan forward so that systems are designed for the long term, according to projections that we make on our population. In terms of the patient, I think we offer very good services. Probably there is a bit of fragmentation in the transitions of care between one system and another. And this is the point where vulnerabilities occur in terms of patient care and safety. So trying to work in a more cohesive, integrated way across the system, I think would really improve patient experience.
Okay, let's talk a bit about the human resources aspect of the sector. There is a lot of talk, I would say, about the role of third country nationals working within as carers, nurses, mostly carers, nurses, but also as medical doctors. And there are those who say that this is a problem because most of them, if not all of them, are not able to communicate in the Maltese language, and this is causing problems, hardships for Maltese patients, especially the elderly. What's your take on this?
I would agree in terms of language barrier. Recently, my mother was in a home, and I can really feel for patients who are cared for by people who do not speak their language. It must be really hard, isolating, and makes people feel very lonely. But I also appreciate the good work that international healthcare workers do and their contribution to the system. Today, we have to accept that if it wasn't for this contribution, a lot of our services would not be able to function. So I think the solution lies somewhere in the middle. We need a good balance. We need to attract local people to our workforce by making sure that the professions are seen as attractive again, by making sure that we put mechanisms in for people not to burn out, making sure that the working conditions are good, offering clear career progression pathways so people feel that this is worth investing in. But also, on the other hand, as you said, with international workers, there are problems of integration and cultural and language barriers. And there we need to anticipate that even their training might not be all the same. And this, of course, leads to problems, as you said, for communicating with patients, but also safety of care. So a good induction program, having effective language support, not these courses that are very superficial in addressing very basic English and very basic Maltese. I think we really need to dive deeper into the language issue. And if we manage this balance, actually cultural diversity in teams has been shown to be a strength rather than a disadvantage, but it needs to be managed well.
Okay. You're doing a doctorate in business administration at Idea College.
That's right.
How does this help you in your profession?
So the doctorate in business administration, perhaps compared to other doctorates, is less of an abstract theoretical exercise and a very practitioner-based initiative.
Hands-on.
So very hands-on, the research is applied. I think an important value add is the fact that you meet people in the course who are not healthcare professions only, but from different walks of life, different experts in different fields, education, business, law, engineering, IT. And this, of course, makes the discussion very enriching. It helps you question your own assumptions and broadens your perspective. We have to remember that as healthcare leaders, we're not just providing healthcare, we're also managing teams, leading change. We are allocating resources, we're managing budgets, and we're taking serious decisions that impact people's lives and also public trust in the system. Okay. And I think the doctorate itself, this experience has been very useful in this regard.
So you are a healthcare professional, full-time, you lecture, if I'm not mistaken, even at Idea College, you're doing a doctorate. This could be quite stressful. So how do you unwind after such a stressful, typical day in your life?
So I think that probably the activity that unwinds me most is Pilates.
Okay.
I practice Pilates regularly. I also walk. I try to walk every day.
And you live in Gozo?
And I live in Gozo. So
you commute practically every day?
I commute every day or nearly every day. But I use the commute as well for relaxation. You know, I mean, very often the weather is beautiful, not recently, but, you know, even the ferry crossing itself can be quite relaxing.
What gives you, when you look at the future, let's say 10 to 15 years from now, which skills do you think would be most in need in the years to come?
So I think I've already mentioned digital literacy. I think this is going to be a basic sine qua non of any educational curriculum. The more, you know, the field grows, the more we need to have people that, irrespective of their profession, are digitally literate. I also think that people working in healthcare need to have empathy, very important, but the empathy needs to be balanced with resilience. Empathy in terms of looking at patients more holistically. We're talking about patient empowerment more and more. So we need to look at the patient not just as a medical diagnosis, but taking into consideration their concerns, their fears, but also their background, their social, their family context, their personal circumstances, even their health literacy or lack of it. Sometimes we assume that somebody is understanding us. So empathy is very important in building this human connection. But then it needs to be balanced with resilience. Not just coping, but also the ability to manage a rapidly changing environment, the ability to manage uncertainty, to set boundaries, to protect one's own mental health. It's a changing landscape. So the ability to provide professional judgment grounded, yes, in empathy, but also in resilience, I think would be the right way to be able to provide safe and effective care in the future.
Dr. Nadine Delicata, thank you very much for your time. This was the first episode with Dr. Nadine Delicata. In our next episode, we shall be delving deeper into the challenges and opportunities of the health sector. Till then, thank you for your time.